Near-infrared spectroscopy helps to monitor regional tissue oxygenation of various organs during cardiopulmonary bypass, ECMO or critical illness.
The main advantage of NIRS is that it's non-invasive and the measurement takes place continuously.
Visual demonstration of this technique is critical to point out the handling and pitfalls of this method, especially for abdominal applications. Demonstrating the procedure will be Frank. He's a perfusionist in the Children's Hospital of the University of Erlangen.
Begin by turning on the NIRS device and connecting the preamplifiers. Enter the patient's data and select the proper probe according to the patient's weight and intended site of use. Connect the probe to the preamplifier. Make sure that the patient's skin is clean and dry for optimum adhesion. Dry the skin with a swab if necessary, being very careful, or omitting cleaning if the skin is vulnerable. After identifying the correct probe position, carefully bend the center of the probe toward the side of the white cover until it starts to come off. Then gently peel off the cover without touching the probe's sticky surface. Place the sensor on the skin from the center of the probe to the sides, making sure that the edges of the probe are firmly connected to the skin. If the probe disconnects, wrong NIRS values will be obtained. To avoid skin lesions, do not place the probe on very immature or vulnerable skin. If the probe must be placed on vulnerable skin,